I feel there is a misconception regarding nurses following physicians' orders without question. In my experience, that's definitely not the case. So I feel like when I call to clarify physicians' orders, I either get two things. It's either respect and appreciation and, oh sure, let me help you, let me clarify that for you, or why can't you just do that? I don't understand why it's that difficult. One example of when contacting a provider and the response was, this is fine, was an unsafe discharge. We felt the patient was post-procedure, spiking temps, not really cleared by physical therapy. The reaction or response to us was, we feel he's safe, that's it. That's it. No further communication of why they felt he was safe. It was, this is what we expect you to do, and that's it. When I think of a situation where questioning orders, and that goes in the right way, from at least my standpoint, is the physician is open and receptive to questions that I have, and they're willing to take time to explain things to me and just to listen to my concerns and validate my concerns.
One common misconception that I see in my role is that physicians think that nurses do not need to know the plan of care. A great example of not updating the nurse on the plan of care is I had a patient that morning that had a discharge order, and the physician was rounding that morning, and I said, hey, is the patient gonna be going home this morning? Because there's still a procedure pending on their order list. So and he goes, well, oh, no, we'll just get that ordered outpatient. So just send the patient home. I said, okay, because we have transport coming at 11. Everything has already been coordinated. And okay, we'll send him home. So 11 o'clock comes, transport is there. We have the patient on the gurney. Everybody has already done their stuff. Patient is leaving. And they're starting to take off down the hallway, like to leave. And there's the medical team, just happened to be rounding on their other patients. And the physician that I spoke to that morning goes, where is the patient going? And I was just dumbfounded. What do you mean? And he said, we still need to get that procedure done before the patient goes. And so to have that type of communication error in front of a patient is really bad. So this could have all been avoided if the physician had just called me and said that there'd been a change.
Do nurses bite? Yeah, I don't know if I can agree with that. I mean, I would like to think we're as open and gregarious as anyone, really. I think that misconception might be perceived because a lot of times when you walk onto a busy floor, nurses may have that look of intensity of just like being focused, ultra focused, and having this tunnel vision with their patient. I understand you're here to learn, and I'm more than willing to facilitate that process. You know, don't be afraid. We don't bite often. Sorry. A simple introduction would be something along the lines of, hi, my name is Sam. I'm a medical student here, training with Dr. So-and-so. Can you help me out with this? And, you know, my reply would be, hi, I'm Sam. I'm charge nurse today. I'm working with this patient, and yeah, I'd be glad to help.
No, I do not expect physicians to know everything, as I do not know everything. I never expect that from someone else, right? I don't expect providers to have the answer right away. That I don't expect them to have all of the answers. I remember the first time that a physician asked me, what do you think? And I literally paused and had to step back, and I was kind of blown away. It had never happened to me. I guess there was this sense of pride that I had been taking good care of the patient, that what I had been doing had had great outcomes for the patient. And so it really validated all of my work and efforts, and, you know, validated again that I have a professional opinion.
One excellent misconception that I think transcends just the healthcare environment, but also like patients, that physicians are nurses' bosses. In the acute hospital and in most other places, physicians and nurses are actually they're colleagues and they work together. So I had this one example where it was actually a patient that didn't understand that the physician was not my boss. The patient wanted to go outside and smoke. And it just so happened that the physician had come in at the same time. And the physician stated, I don't mind if she goes outside. And I said, well, she's trying to go out. She wants to go outside and smoke. And she goes, oh, can she do that? And I said, no. This was all in front of the patient. And the patient actually said, you have to listen to her. She is your boss. I didn't. And the physician actually stated, no, I'm not Sarah's boss.